This is Cooper. Cooper is currently being treated for a condition, a serious hoof condition called Canker. Right there, Aaron is cutting off his old bandaging. It was just put on yesterday. It's a very intensive care regime. What she's going to do next is get the boots on him, and we pour a solution in the boots it's got vinegar and something called white lightning in it, and it's a sort of a boric acid type solution that his feet get soaked in for 15 minutes to a half an hour every time we change the bandage. Canker, it looks scary, it progresses quickly, and it is difficult and frustrating to manage, but with the right care and with consistency, many of the horses recover and they go on to live sound, comfortable lives, which is what we're hoping for Cooper. What the canker does is it causes the hoof tissue to kind of grow out of control instead of hardening normally, and this also helps create an environment where bacteria really thrive. The exact cause of canker isn't fully understood. Some people believe that it starts with some type of infection, and then it's actually aggravated by chronic moisture. For instance, wet stalls, muddy paddocks, and poor hoof hygiene. It's important to realize that canker is not always caused by neglect. Some horses are just more susceptible due to immune or metabolic issues. Erin's getting ready to pour the solution into the boots, although it looks like she's going to have a little trouble since one's already off. Actually, Cooper is really good for his treatment, much better than many horses would be. He's a really good guy. A model patient, I guess we'd say. So once the boots get straightened out, Erin's going to pour the solution in them, and then he's going to stand and soak for a while. Canker looks like, and you see it, a spongy, white or gray tissue on the frog. And if you scrape a little at it, you definitely will see white. It bleeds easily when it's touched and often has a foul, rotting smell. And the tissue also grows back quickly after they're trimmed. So Cooper has a special schedule now with the farrier. Instead of every 6 weeks like most horses get their feet trimmed, he has to go every 3 weeks to keep the growth of the tissue under control. We also work with the veterinarian. She is actually going to have to sedate Cooper. Cooper also has a degenerative neuromuscular condition called shivers. This causes him to, when his right hind foot is lifted up, causes him to jerk it up harder. He has tremors. This makes it difficult to trim his feet. So the veterinarian will put him under sedation, and he will be under general anesthesia to have his right hind hoof really cleaned out, taking out all of the bad tissue, the affected tissue in the hoof. Now that all the solution is in the boots and he's soaking, there's a technique that Erin had me use of holding his tail and pulling his hindquarters a little bit over to the left, which helps him stay solidly on both of his hind feet while he's soaking. Then once that's done, his hoof needs to be very dry, so Erin dries it thoroughly with a towel, and then we put the special paste on it that the veterinarian has given to us. It has tetracycline and another antibiotic in it also to help kill any bacteria that might be in his feet. And then we put a diaper over that. Erin puts a diaper over that and then wraps it securely with vet wrap to keep everything in place. And after the vet wrap, I tear off strips of duct tape for her to put over everything, and that hopefully will keep things dry. It should keep things dry underneath and makes it a little tougher for when he's moving around. He won't get everything off as fast. He won't wear through the bottom of the foot as fast with all the bandaging. Cooper's unfortunate circumstances may have come about because of having chronically poor feet. Cooper was a racehorse. He's a standardbred, and he raced for a while. Then when he wasn't producing wins anymore, he was taken to auction, discarded at auction, and he was picked up by the Amish. He then worked for the Amish, pulling carts along hard roads for a while until his feet became too weak for that, and he ended up back at auction and was on his way to slaughter when we found out about him and took him into the rescue. So what we're trying to do is help him get his feet healthy. They may always be a weak point for him, but we want to get rid of the canker and help him find his happily ever after. He's a very sweet boy, and he definitely deserves a good home. Thanks to both Aaron's and our farriers' hard work and dedication, Cooper is getting the chance that he deserves. They're taking very good care of him, being very diligent, and we'll keep our fingers crossed as to the outcome and hope everything goes Cooper's way. And there's beautiful Cooper, his Christmas picture this year. He's just a handsome, sweet boy.